managed to make it. In the seat, so I guess it's complete, right? Ultimate Health on Joy 99.7 FM with me, Nortey by Nature. Stick and stay. Right, we move the mountains, cause the walls to fall. Resurrection power, Jesus. And by His grace, we perform miracles. Ultimate Health on Joy 99.7 FM. Yeah, I'm sitting here because He made a way. Balancing all you have to balance. I'm so happy you tuned in. It's the 8th of September. Let me check my orientation, right? I've got the neurologist in the studio again. Can I get some horns? Hello, Professor Albert Akpalu. I used to say Akpalu years back, eh? Akpalu. Next to him, Dr. Augustina Chawe. How about you? They've been with us for the past couple of weeks. We're still focused on the brain and we're talking about dementia today. What is it? What is it not? Is it just an academic exercise just to classify? Can we just talk about what it is, what we will see? Share with us your questions, your concerns, your experiences, your confessions as we attempt to demystify dementia on Ultimate Health. That's right. So, you can hear me, you can recognize the SIG tune, you can recognize the program, you probably know people, you can name them when you see them, but hey, don't take these things for granted. We're talking about dementia and we're seeking to demystify dementia with the help of Professor Albert Palu. He's the head of neurology at the Department of Medicine and Therapeutics of the University of Ghana Medical School, Kolebu Teaching Hospital. He's the president of the Neurology Society of Ghana. I thought they had destooled him, but he's the president, right? I think it's Patrick who's now the president of the epilepsy. Yeah, okay. Right, so he's with us. And then Dr. Augustina Chawe Feli, she's a neurologist, consultant neurologist with the 37 Military Hospital and the treasurer of the NSG. She's been here before. I'll bet you know already. So, ready to roll. Docs, you're welcome.
Thank you very much.
I'm getting used to, doing brain stuff with you guys. Keeps me on my toes. Yeah. But it's great to have you. Last week we took a dip because we couldn't, get the lineup. It was like, the Man U coach trying to get something right so that something right will happen. But we're happy to have you.
Thank you very much. Always happy to be here.
Yeah, September is it Alzheimer's month as well?
Yes, please.
It is. Oh, then we're going to drown in it, right? And we'll hope we won't forget what you tell us. All right, great. Glad to have you here. So when it comes to dementia, are we still spot on the brain dementia? Are we still dealing with the brain?
100%.
100%.
Yes.
As you said the last time you were here, every day is World Brain Day. Every day is Brain Day.
Also 100% correct.
100%. Okay, so I haven't forgotten.
No, not at all.
Right, so we're still focused on the brain when we're talking about dementia. All right. Many people get confused when we say, well, it's not one specific thing, it's an umbrella term. Can you break it down for us?
Sure. So it is indeed an umbrella term. It's a group of conditions under which the diseases that we can say give someone dementia have memory impairment and other forms of what we call higher cortical function. So it's understanding, judgment, even movement, etc. So, but the key has to be memory.
Right.
And then when we also say dementia, you cannot say somebody has dementia just because there appears to be something wrong with their memory, etc. You have to have this individual with these cognitive problems. The cognitive problems have to have been present for at least 6 months, so it's often a retrospective diagnosis. And these impairments have to interfere with what we call activities of daily living. So that is balancing your checkbook, going to the shops, having your bath, cooking for yourself, and other activities of daily living.
Cognitive challenges or cognitive impairment, right? So we're talking about the mind here, right? It's moving from the brain to the mind, things the brain and the mind control. So you're having challenges doing some of these regular routine things that you should not have a problem with. So can I take a leap of faith and say, so would we consider like a child to be suffering from any of these things and therefore under the umbrella of dementia? Because we're looking at a decline in my thinking. Am I right? Can you have a child who has dementia?
That's a difficult question, but my answer is
that's why I'm here.
Yeah, so the answer is yes and no. So yes. So let me go back a bit. So we want to make the point that dementia is a brain disorder. It's not a mental illness. A lot of people, the first thing somebody's having problems, they think it's a mental illness. It's
you're losing it.
Yes, you are losing it. So and it must be progressive. So it's not a mental illness, it's a brain disorder. It must be progressive. And there's lots of various functions, as Augustina said. But the common ones, we say the ABCs. We try and break it down here. So your ability to perform different functions, that's the A, B, your behavior, and C, communication. So all these are important. Now there are other diseases that behave like dementia. So in children, Down syndrome. Down syndrome is the condition in which all the children look alike. It's a problem with your chromosomes. They have dementia, and Down syndrome has been used to study the progression of dementia. So you are right in saying that some children can have, but it is the progressive and irreversible nature of the conditions that you are talking about. Meaning that you have to differentiate it from normal aging, we'll talk about that, differentiate it from reversible causes of these memory problems. For example, multiple drugs. Many older people take multiple drugs. There may be interactions. Two, there are certain diseases, conditions like infections, which can challenge your mind and make you behave abnormally. A simple thing like a urinary tract infection or a chest infection can make somebody behave abnormally.
So if it's secondary to some of these things,
you have to exclude those first before you make that diagnosis of a progressive, irreversible decline in your brain function, which could be multiple.
All right, great. 14 minutes past the hour of 2 on Joy 99.7 FM. Ultimate Health, your ultimate guide to healthy living. And we're looking at demystifying dementia. If it's sounding a bit mystical or mysterious to you already, that's why we are here. That's why I've got Prof. Apalu here and Dr. Augustina Chawe Feli here to demystify. Okay, you're hearing a few things, loss of function, but it must be progressive and it must have some certain telltale features and characteristics so that we can distinguish it from other things. Okay. And that is what he was trying to explain. Yes, Doc, you're going to add something.
Yes, I just wanted to clarify that when we're talking about children, we have to distinguish between a change from a baseline.
Okay.
So a child can have a developmental disorder.
Yeah.
And they will have what we call an intellectual disability.
Right.
And that includes some of the cognitive impairment.
Yeah.
But for us to say that this child has now developed dementia, there has to be a change from their previous state.
Okay.
Then we can call it dementia.
All right, so you start to understand that this is serious stuff for serious people with higher qualifications. Don't go around tagging, naming people and saying, hey, wait, dear grandma, auntie, say my catch out, Joy FM, right? And if it's secondary to many of these other things, that has to be ruled out or properly assessed. Okay, that's why you need to listen to Joy 99.7 FM. No other stations. We're not secondary to anything. Primary, right? That's where you get all the facts that break down the fear. We're talking about dementia. Okay, coming back to it. All right. So, again, these changes happen over time.
Yes.
Right? And these changes, first and foremost, are physiological or they're happening to my brain.
Yes.
All right? Before we even get to the signs and symptoms, something is changing with my brain. Yes. What is that something?
So, let me make it even more scary.
Okay.
We now know that before you start exhibiting the symptoms and signs of dementia, which we'll list very soon, the pathological process or the process in your brain has started 20 years ago, 5, 10, 15, 20 years ago.
All right.
So we are also understanding what that process is. So your brain should function, but the brain is also processing several things. So the brain produces waste products. So when there's accumulation of the waste products, like when Zoom Lion decides not to collect your rubbish on the roadside, it will be there. That's what happens in the brain. So there's rubbish in our brain. So
waste
products in our brain. So those waste products there are two. You must know the terms. One is called amyloid, which is a protein, and the other one is called tau, T-A-U.
Okay.
So when you have aggregation of these products in your brain without your brain having a breakdown of the waste clearing
so your brain
system
is supposed to
get rid of these. So
right.
when the brain does not get rid of this, they accumulate, they deposit, and they cause damage to your nerves. So that's why we use the term neurodegeneration.
Okay.
So breakdown of your nerves in your brain will lead to loss of volume, which is also equal to loss of function. So if it's the front of your brain where your memory is formed, accumulation there, you have memory loss. If it's in the other part of your brain where your judgment is happens, you have loss of judgment. So it goes on. So we need to improve the waste disposal system in our brain.
Okay.
If we don't do that, we get accumulation. So that is the current thinking for dementia.
Great stuff. Well, I'm not talking to Zoom Lion, please. This is Ultimate Health on Joy 99.7 FM. Prof. Apalu is trying to break it down to street level, right? What is happening and what's some of the causative processes of this cluster or umbrella of conditions we call dementia, okay? But let me just skip back to something you said. Volume. Yeah. Does that suggest that at some rate and in some way and to some degree your brain is shrinking? Is that what you meant?
That's exactly what he says.
Oh,
so
come on, spare me.
To slightly simplify what Dr. Kwalu said, which was absolutely correct.
Right.
all the terminology can be baffling and confusing.
I'll take a woman's view any day.
So
yeah,
the waste products he mentioned.
All right.
One, they are formed improperly, and then they are also having the brain has difficulty getting rid of them out of the brain so it doesn't damage.
Okay,
so
hang on. So that difficulty itself is an abnormality.
Yes.
It's a deviation from the norm.
Absolutely.
Play.
Then what happens is that these waste products cause cell death to the neurons, the brain cells.
Okay.
So what he was trying to say was that long before an individual starts showing signs that others can identify or they themselves can feel like something is wrong, about 50% of the key cells that are involved in whichever process we're talking about, so either the frontal lobe or the temporal lobe or other posterior parts of the brain, are already gone.
We've lost them.
Which means by the time we are making a diagnosis, we are running behind the bus rather than driving it, which is why science is trying to get us into the driver's seat so that we know how to, one, prevent those proteins from being formed, from them accumulating, and how to get rid of them.
So we can prevent this?
Yes.
Okie dokie. Folks, 20 minutes already past the hour of 2 on Joy 99.7 FM. We're breaking down, demystifying dementia with the neurologist in the studio, right? It's a brain disease or brain disorder, right? It is not a mental illness. Of course, it can lead to behaviors that may raise your concern, all right? But it is not classified as a mental illness, and we're trying to break that down. We're taking our time. WhatsApp is 055 11 997. We're live on Facebook and YouTube, and shortly I'll activate those neural pathways we call the phone line, right? So that you can get in and talk to us. We're with the NSG, the Neurology Society of Ghana. The president is in the house with the treasurer, and the way they look at each other and talk, Charlie, there will be no money trouble there. They will move forward. But essentially, we want to inform and transform you, especially when it comes to this, right? I've just run from home. I've left my 87-year-old mother there, all right? I won't tell you about last night, but I'm very hands-on, apart from my profession as well, right, with regards to what we're discussing. But we want you to be a bit more hands-on, get to understand, and then you can now position yourself to even assist, right? Help rather than harm, rather than offend, rather than insult the person. We need to know what to do. Right, coming back into the studio. So essentially, it's the same thing as losing our forest cover or what is happening to our rivers and stuff like that. If we can stop it.
We can stop it.
We can stop it. Right?
They're potentially preventable.
Right? Yeah. We can prevent this abnormal accumulation of brain waste or neurological waste, whatever you call it, and then make sure the processes are working. Yeah. And therefore, by and large, our brain, if we're not doing anything else,
to slow the process.
To slow that process down. Okay. I'm glad you brought that in, Prof. Yes. Let me ask you, so this deterioration, is it normal? Does it happen to everybody? Can we say it is part and parcel of growing?
So, yes and no. So the path.
Today you are giving me a lot of yes.
Yes and no. So the yes in that there's your body breaks cells, you lose skin.
Okay.
You have to reboot.
Right.
You have to. That's why we need to sleep. So sleep is an excellent regeneration process. Right. So for both adults and students, before you write your exams tomorrow, please sleep. When you sleep, your brain reorganizes and reorders and gathers and forms your memory, so you can always get. But if you don't sleep, we all know it, you cannot process, you cannot recall. So sleeping is good. Sleeping is an important function. But yes, your body degenerates. Your body has processes for revitalizing and regeneration. So there's a process. So there's something called normal aging. So normal aging is there, but some people age worse than others. So we have people who are in their 90s who are doing very well. I attended a lovely 90th birthday party for one of my young girls. I call all my patients above 65 young girls. So, for young girls. So there's a process of normal aging.
So you could be advanced age,
yes,
and everything
says. So that's where we look at. There's always a cause for something. Unfortunately, the health-seeking habits of I won't say of an African is that we want to look at who caused the disease, not what caused the disease. Okay. So we need to look into that. So there's that process going on. So for example, there's something called normal aging. There's normal forgetfulness. Okay. So there's a difference for me forgetting where I put my key. I find the key, then I take the key, and I said, what the hell is this used for? What do you use this key for? So that is a problem. Level. That is another level. Or you are...
And on the address, what trap? Be careful.
you have gone beyond the red light. Or you find you are making coffee. You are used to making your tea or your Milo. Then you haven't taken water. You haven't boiled water. You've taken your tea. You've taken the Milo, and you don't know where the water. What is happening? Those are problems that we need to deal with. And early recognition is key. That's why we are here trying to make as much noise for people to recognize that our seniors don't have SSS. I found that term. I like it a lot. SSS means stubborn senior syndrome.
All right.
So our seniors, sometimes they may behave like a teenager. You cannot send your teenager, you cannot send your mother to your room. Hey, go to her room, go and stay in the corner, or give her 6 lashes like some of us used to have some time back. But we need to know and recognize these symptoms and be able to deal with our seniors. People don't shout on your parents, don't order them, don't be degrading, don't hit them, don't make them feel sad. All these make the symptoms worse.
I forgot to do this.
Yes,
I misplaced this.
And say, can't you remember?
I drank my tea and I'm asking you where it is.
Where it is. Right. Or the repetitiveness of questions. So those are the things that we need to deal with.
Okay.
So I think the way we can also look at it is to understand that age itself and old age is not a disease.
I'm relieved.
So whatever it is, there is indeed, like all our organs, our skin, our eyesight, the brain also does undergo some aging. But that aging and what it causes should not in any way impair function.
All right.
That's why we keep repeating that. It should not impair function. So it just usually takes you a little bit longer to remember where you put your keys, a little bit longer to remember the name of whoever it is you spoke to yesterday. But the difference between that and when there is a real problem is that it not only takes longer, there is no result to it.
Okay.
So if you do find that your elderly parent is asking you the same question over and over again, that is a clue that perhaps something is wrong.
Okay.
Because the person who is successfully aging will ask you the question maximum twice, and then they will know what is going on.
Okay.
But if you keep having to repeat the same thing, then another thing that we have noticed happens often, especially with Alzheimer's disease, is that they tend to get lost in familiar situations. So you're in a familiar environment, but you can't remember what was.
Okay.
So you've gone to visit your friend that you've been visiting for years and years and years, and then you get to the neighborhood and you can't remember which house it is.
All right.
That is a key sign. And sometimes the individual themselves notices it. It scares them. They become anxious. And speaking about anxiety, that's another thing we have to look out for. Anxiety and depression are often precursors to the noticeable memory impairment.
Okay.
So if an elderly person for whom anxiety is not typical, for whom depression is not typical, suddenly starts exhibiting these kinds of behaviors, we should be concerned.
Okay, 28 minutes past the hour of 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon, Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. I'm learning at the feet of great people, and I'm looking up to their brains because they are talking to me about the brain. Dementia. We're trying to demystify it with your kind help, interaction, participation, and inclusion. So WhatsApp is 055 11 11 997. We're live on Facebook and YouTube shortly. In fact, let me activate the phone line 030-221-6541. They're telling me that it might get to a point where I might not remember these numbers, but I'm in a familiar studio, right? I might get a bit confused, okay? We're trying to understand what happens. We're being told that, yes, there's some process of neurodegeneration, right? Your brain actually physically will shrink or is shrinking. There's an accumulation of products that should not be there, should not be sticking around in the system for too long. And then you start to, manifest or evidence symptoms in your thinking, your planning, your processing, your speech, your memory, your ability to remember or identify and name things, a whole host of things. Indeed, confusion be basa. But we're trying to not like Kwame Eugene cause confusion, but we're trying to understand this. WhatsApp 055 1111 997. Phone line is 030-221-6541. Ultimate Health on Joy 99.7 FM. We're doing all this education, kind courtesy of the Neurology Society of Ghana. They've been so kind, so good. They've given us all their top-notch ladies and gentlemen, right? And they're at your disposal. So use those phone lines, use the WhatsApp, and we'll try to, should I say, address your questions and concerns. Okay, haven't come back there. We still haven't said that, we've diagnosed. And a lot of this is in retrospect. Yes. We've also underscored that a lot of this damaging degenerative process has been ongoing. Okay, so are we able to talk of a conclusive diagnosis? Or are we able to perhaps before that look at telltale signs and symptoms? We've mentioned some of them. Yeah. Which is best to do, right? Is it best to zoom in and say, okay, this is how you go, this is where you go, this is how it's diagnosed? Or should we look at telltale signs to bring it closer to people first?
So making a diagnosis is important, but making a diagnosis does not involve only one profession.
Okay.
So making a diagnosis of dementia is a multidisciplinary team process, which is the way to go. So you need a neurologist, you need a psychiatrist, you need a neuropsychologist, you need a dietitian, you need a social worker, you need your priest too as well, and you need a carer. So it is a multidisciplinary process.
Okay.
So we have the warning signs. We have a checklist of the various domains of your brain function, which we look at.
You run through. Okay. Can I just crave your indulgence? I have somebody on the phone line already. Let me take that person and come back to this checklist. Hello, good afternoon.
Good afternoon, sir.
Hi, who am I speaking to?
Emmanuel.
Emmanuel?
Yes, from North Legon.
North Legon. Okay, share with us, Emmanuel.
Yes, I have a concern. In the first place, thank you for the program being organized. My concern is that I noticed two things about myself. One, I easily forget. The way I used to keep things, I've noticed that now my memory is a little bit down. I don't easily keep things like I used to do. That is one.
Okay.
Then also two, I don't sleep early in the night. I stay deep in the night up to 11:30, 12 before I can go to.
Emmanuel, can I just clarify? When you say you don't sleep, is it by plan? Or is you can't sleep?
I can't sleep early.
You can't sleep. There's a difference. Okay.
Even when I go to bed by 10 o'clock, 12:30, I should wake up.
Okay.
Normally, I go to bed 11:30, 12, and by 3, I wake up. Then during the day, when I see that within a short time, I'll go off. I'll sleep.
Okay, so you sleep during the day?
Yes. I will sit down within a short time and I'm off.
Okay. How old are you, Emmanuel?
52.
5'2" or 6'2"?
5'2".
52.
Yes, please.
Okay. All right. Anything else you want to add quickly?
No, that is my worry. So
okay.
I don't know whether it's a problem.
Okay. All right. Okay, great. Yes, Prof.
Okay, so Emmanuel, it's difficult to process all this in a short conversation, but there are several things. How stressful is your job? What are your sleep habits? Do you snore at night? All these things will affect your sleep and make you sleepy. You have excessive daytime sleepiness. That will affect your memory and affect your functioning and affect these things. So there are several things that we need to look at. So I think we'll have to speak after and then we'll take it up from there. But all these are warning signs. So if you notice, he's 52. So we need to look at these things early. We need to look at family history. We need to look at other concomitant diseases. You see hypertensive, is, do you have diabetes? Do you have high cholesterol? Is he obese? How much physical activity is he able to do? What is his diet like? Is he eating high carbohydrate, saturated foods, or is he eating lean?
Sounds like
foods?
a whole ultimate health program.
Yes, that is eating lean food. Is he under stress? Or does he own a galamsey pit? All these things will help you to reduce stress.
So I also want to add that whilst we have to acknowledge the concern that this gentleman has about his health, whilst of course when he sees his doctor or he's referred to a neurologist, all the appropriate questions will be asked, the appropriate investigations will be asked for. But just to reassure, first, we can't make a diagnosis like this. And then the second thing is, the younger you are, and 52 is relatively young, the younger you are, the less likely it is that we're dealing with a truly irreversible neurodegenerative process.
Okay.
It doesn't mean it's not possible, but the likelihood is not great.
Amen.
And then something that Dr. Akpalu mentioned, even if we are suspicious of the findings that we find, the first thing we need to fix before we can start talking about any other disease is the sleep habits.
All right.
And then there are a whole host of other things that we mentioned in our last programs that we have to mention again. It starts with prevention. We worry less about these things when we're living a healthy diet, living a healthy lifestyle. So having an adequate, well-balanced, nourishing diet, sleeping adequately. So if there are sleep problems, addressing them, getting to the bottom of them and trying to fix them. Exercise, abstaining from alcohol, smoking, other substances, etc.
Which we emphasized when we did brain health.
Exactly.
Yes. Okay.
Because all of that, ultimately, when we are not healthy in other spheres, it affects brain health. And if brain health is suffering, neurodegenerative processes speed up.
Okay. Well said. All right. So, Emmanuel, we hope that sets you on the right path. You've listed some symptoms, some complaints and challenges. They have to be put in proper context of your whole health status and well-being, and then the right things can be said. Coming back to the warning signs and the checks that Professor Akpalu alluded to earlier, let's see if we can get some of those at our fingertips.
Okay. So one, if you have you have your elderly patient or your parent or anybody, all of a sudden he stops eating, not eating, he's not taking his medication. There's lots of initiative. They don't want to partake in anything. They have paranoia, they withdraw from society, they are suspicious that you've taken their money, you've hidden their things, they get lost, they are sad, they are more confused, they wonder even in the same environment that they are, and they start losing weight. There's just a progressive decline. Those are warning signs, and unfortunately we miss a lot of these signs. And
warning
we just
signs.
And just say that our mother or father has become stubborn. But they are not stubborn. We need to understand. We need to understand these. We need to understand these warning signs.
So the other thing I think that is important and is something that we have to look at culturally as well is, especially those of us who are slightly more well-to-do than others, we like to be thankful to our older parents. And once you have retired, we reduce intellectual activity, we reduce physical activity, we reduce social activity in the name of, oh, you have worked a lot, you have done well for yourself, now sit and rest.
Enjoy it.
That is actually really, really bad for the aging brain. You need to maintain physical, social, intellectual activity in order for it not to be lost. Because what happens when we do that is the person says, oh, no, you don't do anything. We'll cook for you. We'll clean for you. We'll go out to the shops for you. Oh, don't worry about church. It's too hard. Getting into the car is difficult. And so by the time the family realizes that the individual has lost the ability to do things for themselves, it is already far gone. So we should encourage ourselves. We should encourage our older...
Is that a process of decay and disuse, or disuse and decay?
Yes, essentially yes.
If I'm not using my faculties,
use it or you lose it.
Absolutely.
Use it or lose it.
Yes.
All right. So remain active, remain integrated, remain connected. It also is.
That is when you can notice earlier that something may not be right. But if you leave it till the person's doing nothing, and so before you realize that they can't walk at all, and by that time when you get to the doctor looks at you in despair and says there's nothing we can do.
All right. Yes, just a second. Linda in Osu, let me add your tag. Evergreen Linda in Osu. Good afternoon. I always see old people with this disease in foreign movies. Does it only happen to the old people?
No. So you can have young onset dementia, which we are not going to go. That's a technical problem.
All right. Pre-dementia.
Pre-dementia. So we're looking at people above the age of 60.
Okay.
So one of the warning signs we haven't mentioned is this misplacing things.
Okay. Hang on a sec. Yes. Many of you may have heard the phone number, but hey, you can't handle it. All right. So let me give it out again. 030-221-6541. 221-6541.
Not it slowly so that they can comprehend.
030-221-6541. All right. So I'm expecting those calls. Yes, Prof.
So misplacing things. So there's benign misplacement. So you can't find your keys or your glasses. So what happens is that they go and hide. So most of our patients, warning sign is hiding. They go and hide. They go and hide their money, hide their glasses. They'll go and put their car key and put it in the freezer, or put the kettle in the freezer, or the worst, as it goes progressive, they go to the bathroom. There's water in the WC, and there's the sink. Then then they take the water or start brushing the teeth from the toilet. That is
which one is which?
Which one is which?
So
those are warning signs which we have to pick up. Unfortunately, because of migration, a lot of children are not there for their parents. So we have people living. It's a big problem we have to address.
Okay.
So parents, some elderly people are living by themselves. The social network,
the older version of Home Alone.
Of Home Alone.
Yeah.
They are there by themselves. They have no clue as to what to do, and everybody is gone. The family network is not the same. Yes, when you were enjoying, you didn't involve the extended family, so nobody wants to help in. So we have a big crisis on our hands. So we need people who are trained to help care for our elderly people.
Okay, all right, great. So you're not doing this with lay persons, people who don't know, or people who just happen to be related by virtue of blood, and therefore they must care for the person. You need to know what you're doing. You need to know what is happening, and you need to know how best to help and support this person, right? That's what Prof is talking about, and that's why he emphasized and underscored the multidisciplinary team that is needed, not just to pin this down, but also to help manage it. 030-221-6541. Next weekend, the 13th, we have the EcoBank Joy News Mini Fair, the Habitat Fair, going on at the Good Park near Accra Mall from the 13th to the 15th of September. All right, it's open from 8 a.m. to 8 p.m. daily, and admission is free, which means probably you will not get the benefit of Ultimate Health. But we're telling you, it's also good for you to have shelter, right? So then you can listen to Ultimate Health, not from the streets. All right, so the Habitat Fair is next week, 13th to 15th September at the Good Park, GHUD, Good Park, near the Accra Mall. All right? And it's free 8 a.m. to 8 p.m. daily. Coming back to the business. So these telltale signs and the checklist, right? I'm sure many people are, figuring out, hey, shall I do a bit of that and a bit of this? And this is my age. Am I in the spectrum, right? Good afternoon, doctors. Please, I've been experiencing a sound in the form of ringing. I guess it's some ringing in the ear. Yes, can this be due to aging?
So we call it, you have tinnitus or tinnitus. So it could be due to several things. Young people have it. Old people have it. If you've been slapped before, very well, you have that too as well.
Why are you smiling as if you've been slapped before? That slap is known as ENT, ear, nose, and throat. It covers all of you. Right.
So just to clarify, it's is more likely to occur as an individual and their hearing apparatus ages,
right?
But by itself is not normal. Okay. So if you are experiencing it irrespective of your age,
in your ears, right.
If you're experiencing it irrespective of your age, see a doctor, either get reassurance that it's nothing serious, or if there is something, they address it.
Okay.
With respect to the lady who asked about age and dementia,
right.
It is true that the older an individual is, the greater the likelihood of developing dementia, but it's not limited to the older age, just to be clear.
Right. So we've talked about, memory changes, right? Is it just for immediate, current, recent, short-term memory? Does it go further back than that? Because sometimes you say, what did you eat this afternoon? I can't remember, but I've eaten, right? Or sometimes I brush my teeth and I'm not quite sure if I brushed my teeth. That's current, recent, okay? And I'm just asking, with memory loss, does it affect the whole span?
So that's actually why most people don't notice that someone is losing their memory, because when you ask them the question, does your father or your mother have memory impairments? They say, no, they remember things from long ago. There is a law called Ribot's Law, and the way we lose our memories are from the newest then to the oldest.
Okay.
So the first thing that you notice is that recent memories are the ones that the individual can't remember. Exactly as
who
you
came
said.
To visit
You brushed your exactly.
Yesterday was all right.
Rather than who I went to school with when I was in primary school, that you remember for long.
Okay.
So as the memory impairment progresses, it goes from recent things to older memories, and then to skills, the how to do things.
Right.
That also gets forgotten, but that is further into the progression of the disease.
Okay.
So if you have noticed that, unfortunately, we are late.
We are on the road.
Exactly.
All right. 45 minutes past 2 tells you we're on the road. We're well on the road. Good afternoon, Nortey. Please, I'm 40 years old, and I started having seizures about 7 years ago after hitting the back of my head on a hard surface. And ever since I started having my seizures, my memory has been impaired to an extent that I can't sometimes remember people and experiences, but I'm active though. Please, any help for me? And can it be totally dealt with? This is from Jones in Bubuashi.
Jones.
Yeah.
So Jones, so when you have a seizure means that you are you are losing some of your brain cells. So we need to reduce the frequency, stop the frequency of the seizures. That is our responsibility.
Okay.
And he may have a lesion in his brain from the fall or a cut. That is loss of function.
Okay.
Loss of volume is equal to loss of function.
All right.
So it depends on where it is. And when you have uncontrolled seizures, you have some memory impairment. So he needs to come see his doctors and let them sort this out.
All right, great stuff. And you remember that we have had Professor Patrick Ajay and Dr. Fifi Dodu here. We did epilepsy. So, hey, go back, look for some of our recent editions. You get all the information. But if in doubt, go to a health facility. Yes, Prof.
So I wanted to talk a little bit about predictability.
Okay.
So predictability, daily routine for our elderly patients. Please don't move them around. You are in 3 children. One is in Australia, one is in the UK, one in the US. Every 3 months they move them around. Should be confused. Even within Accra too as well. Disoriented. Keep the daily routine.
Structure and routine.
That and predictability. That's very important. And then independence. They took care of us. They spanked us when we were little children. They gave us pocket money. Then all of a sudden, you are giving them instructions. Don't eat. Don't do this. Caffeine, don't do this. Sign the check. Bring it. So that is a big problem.
Sit in the back of your own car.
So we need to be gentle. There's a lot of love and understanding when it comes to dealing with our elderly patients, and it's important. So do not shout. Do not reprimand. Do not treat them like they are little children. Right. And I had one of my patients who was very sad. So I said, Grandpa, what is wrong? He said, I don't have any money. So I said, why don't you give him pocket? Even if it's 10 cedis, he'll hide it somewhere, but you give it to him so that he knows that he has some money.
My niece sent me money. They haven't given it to me. I want to see the money. Right? But it's about being disempowered, isn't it?
Yeah. So their self-esteem is gone.
You lose autonomy.
They lose autonomy. So we need to give them some of them back. So empathy, the way we talk to them. If you want the person to see, some people have very strict rules. There's no point in telling your 90-year-old father at 7 o'clock you must bath. You haven't bathed. You are stubborn. Go and bath. No, if he doesn't want to bath, leave him alone. After 2 days, take a water hose and hose him down.
My mom will tell you, if they are afraid of an old woman's messy hair, then they shouldn't come.
They shouldn't come.
Tidy up. We're having this. No. I'm fine.
Yeah, fine.
Right? I'll take my time. Right?
I think this also brings up an important thing that we have to take into consideration, and that is elder abuse. Yes, taking care of
makes
an
them very
older
vulnerable.
person, especially with a health issue, with cognitive impairment, etc., can be very frustrating and difficult.
Right.
And the problem with elder abuse is that your intent to deny them something is not required for it to still be abuse.
In fact, the most common form of abuse is neglect. Doing nothing at all.
Yeah. So I think we have to not make people feel like we're blaming them for anything, but just understand that yes, it is difficult. But just because it's difficult doesn't
give you the right.
Exactly.
Right. Okay. And chronic long-term caregiving support.
It's expensive.
It's expensive and it's difficult and it's a lonely road. Right? Don't go in there with your eyes closed thinking just because of love and relationship and bond, right? You've got to understand these things.
So before we get to some of the things we have to look out for. So our elder patients have problems with vision, have problems with hearing. So I have patients who come to me. And you should have a lot of humor in the way you deal with them. So patient came said, Doctor, so we look into their ears. She's not been hearing. So she comes the next time said, Doctor, him said Chinese for countries, sir. I said, they're in program now. Is that I'm sure? Hey, the people are so she couldn't hear. She's been watching the TV. She didn't hear the Chinese people speaking tree. And what do they say? What's the program? Kum Baja or whatever they call that. So she came back and said, Doctor, they are speaking. Chinese people are speaking tree. So she did not hear. So let's check the vision and the hearing. That's important. So you are shouting at them. They are not hearing you. So they are not obeying what you are saying. So,
not only that, but visual impairment and hearing impairment are actually contributors to speeding up of cognitive impairment. So what is fixable by glasses, hearing aids, does go a long way in making them better.
Fix those ones.
And then your body language. The way you smile, they can hear, they can feel, they are very sensitive. So don't shout when you can insult somebody by looking at them. So be happy in their presence and don't talk over them. They are sitting in their room and somebody comes to me, Papa, or you're stubborn. And he doesn't know what is coming in for him. He understands. He knows what you are going to see. The next time, he'll be weaving from the hall to the bedroom and then back because he's punishing you for doing for you doing what. So these are little things that carers have to know, children have to know, and spouses have to know that they cannot do it by themselves.
All right. Let me hit you with this one. We hear very often elderly woman appeared here, few states, they are disoriented and stuff like that. I tend to say many of them are in these situations because they are not as functional as they used to be. They are not well oriented. They are unable to communicate. And then they say,
it's a witch.
It's a witch, right? We hear a lot of these things. Sometimes also they report hearing and seeing and sensing things without the sensory input. I'm seeing something which is not there. Would that fall into this spectrum? Can you address that? So when somebody gets lost and, outside they have name tags, they have information on them and so on and so forth. But here, straight away, you're a witch.
We do have certain cultural aspects that we need to address and change in order for all our people, including the elderly, to get appropriate care. But speaking of hallucinations and hearing things, visual and auditory hallucinations, again, visual impairment contributes to that. Hearing impairments contributes to that because the brain does not like emptiness. If it is not getting the images it wants, it will make those images up. If it's not hearing the things it wants, it will yes, exactly. And
fills in the gaps.
Some of the neurodegenerative diseases have as their components, in fact most of them have as their components what we call neuropsychiatric symptoms. So you can have hallucinations. The other thing is some of the medications that we give to our patients can make them have hallucinations of all sorts. Right. And so we have to be very careful for how we treat pain, how we treat infections in the older category of patients, because those medications can actually worsen things sometimes. Not saying deny them the treatment, but choose your treatment appropriately. Right. I will give an example, a very common example. Someone says they have a headache, they're given Doretta. Doretta is paracetamol and tramadol. An opiate in an elderly person will behave completely different than it does, and it's still bad for a younger person, and can worsen what is already there or trigger it and then now be the new step.
So Nortey, the wandering is a big issue. So people are left alone at home. They open the gates, they go out. I'm lost. Looking for my son. I'm looking for this. So they remember that they've been somewhere before. They get into a car and then they are gone, and they find themselves somewhere else. Now that is one part. Some of the elder patients may have seizures as well, and in a seizure you may be in what we call a fugue state. A fugue state, you don't know what you are doing. You go to the transport yard, sit in a car, you're in an STC bus or VIP bus, you get to a place and you don't know where you are. Just before I came, somebody sent me a message that there's a woman who comes to the front of a gate every time, and they try and sack her, and she's adamant that she knows somebody there. So these are all symptoms of dementia which we need to address in a holistic fashion.
You guys are definitely locked down for about 6 weeks.
and I think in general, as people, we need to be kinder.
And more caring.
Absolutely.
In fact, I can link some of these directly to Ultimate Health, because I remember a good friend of mine literally lost her father. Her dad went missing. And he has roots back in Nigeria and stuff like that. The thinking was that maybe he's boarded the bus and gone to Nigeria. And, I was leaving. Then Ultimate Health was on Tuesdays. I was leaving home, and we'd been talking about, have you found him? And this and this. So and so is going here. And at my junction, and this man had moved. I won't even mention where he's moved from, but I'm sure if she's listening, she'll know. And he was at my junction, Latebi Okoshi Kolebu. Then I said, hello, are you so and so? I don't want to mention the name. He had soiled himself. He was dirty. He looked like he was mentally ill and all that. And I had about 20 odd minutes before my show. I took him home for my old lady to clean him up and everything. Came on air, but I'd called my friend and said, guess what? I found Dad. Right? And this was like just a miracle.
It's happened to me as well.
Right? He could have been anywhere.
Anywhere, yes.
Right?
The one I had, he was beaten up in Osu. And somebody remembered that he comes to my clinic. So they brought him there in the middle of the night. His carer had left. There was nobody at home. So we needed. So these are big issues that we need to deal with. So for us, the communication is important. The way we talk to our individuals, we talk to this, and there are three before we leave and come back. I'm sure we are going to be repeated. So we take the repetition.
You ain't going anywhere.
We take the repetition.
Not even if you are disoriented. So
there for this show, there are three good rules. One, to your patient living with dementia, don't ask questions. What have you eaten? What is today's date?
Closed-end questions.
No. Listen. They are the expert. Listen to them. If they said there's goat I had a patient who said he see goats in the room. So I said, okay, let's kill one of the goats and make light soup. After eating the goat light soup, the goats have gone away. So be innovative. Listen to them. Understand them. Don't argue with them.
What if they're mentioning dead people?
They are there. We all die what they do. Not contradict them. So let's do not contradict these three golden codes. Do not ask questions. Listen to them. They are the experts, and do not contradict them. So you go with them in the flow. Go in the dispassionate, empathic fashion.
Dance with the resistance.
With those who have hallucinations, there are different types. Some are very distressed by their hallucinations, and that for sure needs management. But those who are not distressed by their hallucinations, the medication we dislike more than we dislike the hallucinations. And in fact, we haven't mentioned this in terms of treatment. So some of the types of dementia do not have of the dementia itself a treatment, but it doesn't mean the individual does not have management they can benefit from. So we look at things like their hypertension, their diabetes, etc. And then making sure they're as comfortable as possible in the situation that they're in. Occasionally, we don't like this, but occasionally, if they are distressed by their hallucinations or they're agitated, aggressive, we do sometimes need to give them medications that we call antipsychotics. But that should be a last resort. And even more of a last resort are restraints. We should, as little as possible, in fact, I would go as far as to say never restrain an elderly person with cognitive impairment. Because that only makes the situation worse, causes more complications, and expedites the end that is inevitable to a sense, but there's no need to make it faster than it needs to be.
This is from Pasolo in Sunyani. Many thanks, Pasolo. He says, greetings, Ultimate Health Team. Please, may I know if there's a correlation between stroke and dementia? We're still on that page.
Yes. So we haven't, that is a form of dementia in itself called vascular dementia. So we need to look at that. So also, we have to reassure our patients. We have to reminisce. So instead of asking that, hey, don't you remember our wedding date? Don't you remember when we got married? Reminisce. So, hey, when we went to San Francisco, we went to Choco by the sea, and we're eating this. Then they come in. So it's like call an open door. Go back to their memory, jog it, and bring it back. Reminisce and redirect. Don't say, hey, don't you remember this? No. Our voices, we shall calm our voices. It's frustrating when somebody's asking you the same question 5 times. Have I eaten? Have I eaten? Don't say, don't you know that you've eaten? No. So just calm down and say, yes, Daddy, we gave you this. And then you remember. But don't shout. If you shout, they'll rebel.
One shout.
Yes.
Okay. Good afternoon. Thanks so much for the education. My mom will always complain of birds in the room. And no one will see anything. She was 64.
Catch one yourself.
Birds in the room cry small.
Small. Me, do you know what happens to me? But they come to me in clinic and I'm accused of sleeping with their wives. That's a delusional hallucination. So they come with the family head and they come and I said,
is this Nortey?
So we've been to court. So there are several things. So please let us. There are lots of issues. Families children are fighting over property. Children are fighting over this because the parent has dementia. They want to take control, and it's a whole ball game out there. So I think maybe something we'll try and understand these things and help each other, but care for your elderly people. Our job is not to preserve, it's to nurture old age. It's to preserve old age. And for children and siblings out there, it is in the I'm Catholic, so the book of Sirach says, look after your parents in their old age to atone for your sins and atone for several things that you've done.
Amen.
So let us go with that.
Is your Osofo as funky as this one? But let's just hit this before we go, because it does dovetail into even personality changes.
Yes.
And mood and other things that close, significant others find it very difficult to understand. And even in quotes, tolerate.
They're stubborn.
That they've changed and now they're saying stubborn. This and so on and so forth. Can we just say a bit on that? Because that's also part of the spectrum.
Sure. Again, it depends on which part of the brain is involved. And to answer the gentleman's question about stroke and dementia, the more stroke an individual has, the more likely they are to develop cognitive impairment. The stroke itself contributes to the neurodegeneration and can make a process that was already ongoing go on faster. And then depending on because there are a whole range of different types of dementias. Depending on the type of dementia, sometimes at the forefront of the symptoms that the individual presents with are behavioral, personality changes, mood changes, etc. So those are all things that we have to take into consideration when we're managing. And then all of the different dementias, when they are far advanced, they're almost impossible to distinguish from each other, and they all have elements of aggression, agitation, mood, behavioral changes, etc. So if you find that someone's either mood or behavior is changing and not characteristic for them, do ring alarm bells. The other thing is, sometimes you ask the individual and you see a patient that clearly has behavioral abnormalities.
Right.
And then they say, oh, he's always been stubborn. Yeah. But
so we
still,
think it's an extension.
we think it's an extension. So we thought nothing of it.
Yeah.
But it's actually, if it is worse, if a human being is doing things that are not appropriate to the situation, to the place, to the person they're dealing with,
Right.
whether or not that's their characteristic, it is not normal.
Right.
And so it needs to be addressed.
Okie dokie. And they are a very important segment of our population, of our lives, of our culture. And we need to start getting closer to these issues and getting a better understanding and hopefully a better management of them, so that, of course, we are very, very reticent or resistant when it comes to things like old people's homes,
yes.
and so on and so forth.
Which are coming. They are here.
So we need to
them.
get a better understanding of these things, and I'm so happy that the NSG Neurology Society of Ghana is helping us with all of this work. We haven't even scratched the surface.
No.
Not
The
at all.
surface. We haven't even, somebody will say, well, is Alzheimer's one of them? Is it the same thing? Is it different? And so we'll do all that, and then we'll get into management, and you see the kind of multidisciplinary team that we need to get this done. It's a lot of heavy lifting. Thankfully, most of those members of that multidisciplinary squad are present in Ghana, but it's tough, hard work. And on the flip side, too, it's very expensive, especially if you're doing it the wrong way.
And then
right?
we need support groups, which we have.
Yep.
We have Alzheimer's Ghana and Golden Chapter Foundation. So they are excellent resources.
The interesting thing about that is in 2000, I got the opportunity to join ADI, Alzheimer's Disease International, in Washington. And we had the singular fortune of them offering to set up Ghana's ADI chapter here. But a colleague frustrated that and disappointed us, and then Nigeria rather took the lead. And then later I've heard of these other groups.
So we have a comeback. We are part of the Alzheimer's Association International. We are doing a lot of work. We are doing some projects on dementia in Ghana too as well. So we'll talk about that. I can't go before I have to do a shout out to two of my 90-year-old girlfriends, Madam Vida Kumi. Auntie Patricia was 92 weeks ago. And then Madam Janet Buhini.
Hang on. Go back.
Yes.
First was Vida.
No, first was Janet Buhini, Mrs. Janet Buhini.
How old?
90. She still walks, she can drive, and she does everything.
That's why she's your girlfriend.
That's what, yes. And then and Madam Vida Patricia Kumi is also 90 last week. Hey. So that's
Happy
why
birthday,
I couldn't be on this. She said, "Fun. I always fight them. They must dye their hairs. We are still on that fight."
You are a toy boy.
But
and then who else?
So these two and those who are coming up to as well.
Okay.
Yes.
Any boyfriends, ma'am?
No, I like all my patients.
You have nothing to declare.
No.
Many thanks, Dr. Augustina Chawe Feli and Professor Albert Akpalu of the Neurology Society of Ghana. We'll do a bit more. Next week we're off because of the Habitat Fair. Comes on from the 13th to the 15th of September at the Good Park near the Accra Mall. The fair is open from 8 a.m. to 8 p.m. daily, and admission is free. So, hey, let go of the overpriced land, home ownership, and furnishing details, all the wahala. Go there and they'll sort you out. All right? That's what we're doing next week, Sunday. So, I'll be, as they say, the guys will say, off hair. I won't be on air, right? Take a stay on Joy 99.7 FM. Many thanks to you, my discerning listeners. We haven't scratched the surface. We're just about demystifying dementia. Take a stay. Abeku's up next with some funky stuff and bashment. I'm out. My name is Nortey by nature.